Everything I'm doing with all my strength is for my kids. They give me so much joy and hope. Like whatever it takes, I have to fight and get out of this.
So when I became a parent about 17 years ago, I noticed an instant shift in my brain, which was I no longer was first in my mind, and my child was. And I know that we are all parents today and can relate to that. Absolutely. And so today's subject is about what it feels like to go through cancer as a parent and still be the same parent you want to be to your children. And so I thank you all for being here today, and we'll start clockwise. Dr. Tippey, with you introducing yourself and letting us know what you do.
I am a clinical psychologist at Siteman Cancer Center. We often help patients navigate parenting with cancer and a multitude of other issues.
So my name is Faith Kilango, and I'm a mother of two beautiful girls, ages 9 and 7 and 6. And I have been diagnosed with stage 4 cancer of choriocarcinoma. Almost 2 years now down the line. Yeah, and we are almost through it.
My name is Andrea Hagemann. I'm a gynecologic oncologist here at Siteman, and have the privilege to walk with Faith through this really long process of cancer treatment that you've been through, including surgery, radiation, chemotherapy, you name it, all while mothering these two kids and being a wife and a caregiver by training. So to say that you've inspired me is a very big understatement, but you have.
Well, let's start, Faith, if you don't mind, with your journey that started a couple years ago with you noticing something different when you were back home visiting your family. Can you take us back to that time and tell us what was going on?
Yeah, so it started with a cough. We had gone to Kenya for vacation, and the cough really continued for a while, and I tried over-the-counter meds. It didn't work. And then also the cough wasn't just a cough, it was accompanied with blood. After some time it starts again, and we were I think this is serious. Though we didn't want to start finding out what was going on when we were still there. So when we came back after the vacation, immediately I had to see my primary doctor. And then, unfortunately, it kept on persisting, and he referred us to ER. And then they found out a very big mass on my right lung, the lower lobe. So that's how I ended up in Dr. Hagemann's hands.
And Dr. Hagemann, most people would not assume that a large mass in your lung would actually have a source of cancer that started in her uterus, correct?
Right. It is surprising. I think one of the things that clued us in was one of the lab tests was a beta HCG, which is actually the hormone we check when we think we might be pregnant. The beta had climbed significantly, and now a mass in the lung. So with all of those pieces together, the beta HCG being high and this mass, it was pretty classic diagnosis of gestational trophoblastic disease. And it's one that we make actually without needing tissue. Sometimes we need a tissue diagnosis to diagnose, say, a endometrial cancer or an ovarian cancer or a lung cancer. But in this case, this tissue is very vascular. And that is why you are coughing so much blood, because it can be very dangerous to do biopsies in these situations, and even the lung surgery can be fraught, even done under very excellent conditions, can be very vascular and morbid. So in fact, we want to shrink it with chemotherapy. So that's what we did. We started on chemotherapy. Actually, it also ended up, we did some scans.
Oh yeah,
more scans. So she had mets in her brain as well as an area in her brain that also not actually that uncommon with choriocarcinoma.
And so at this point, can you remember what your first initial reaction, next to disbelief, what the next one to that was, how you were going to face this and tell your kids? And
sorry. So it was hard first to grab everything in. I and my husband. And one of the worries is how can I tell my kids about it? They are just 4 and 7 at that particular time. Where will I start? How much information will I give them at that particular time? Was it necessary to tell them? So we wrestled with a lot of stuff. How will it impact their lives after that? But we had shared with family, we had shared with friends, and we figured out probably it was time to tell the kids because we didn't want them to find out from the parents, from the other kids through other parents. They better hear it from us. But we had, me and my husband, we had to come to a point where we were at peace because I already wrestled within myself for a week or two. Why me? Why this rare stuff? Why should it target me? I mean, out of all women, why should I be the one? And that was really hard. And at that particular time, I had to tell cancer, you know what? I'm not gonna go down without a fight. Yeah. And that made me be at peace. I told the cancer, can you see my kids? They're just 4 and 7. I'm not ready to lose them. They're not ready to lose me. And if you decide this is going to be a battle, then you chose the wrong body. I'm not going to go down without a fight. So I had to be at peace at that particular time and tell myself all will be well. My husband is so supportive. I didn't see him break. He wasn't stressed out about it. So that also gave me courage. Yeah, and he's a scientist, so he told me, oh, yeah, don't worry about this. This is going to be okay. I have checked all the case studies and all that.
He's a medical researcher in infectious disease, so he knows how to read case studies.
Yes, so he says, out of these cases, all of them survived out of it. So that itself also gave me hope. Yeah, and I was ready to battle it. Yeah.
Dr. Tippey, how common is this question, I'm sure, for newly diagnosed parents, what to say, how to break the news? I mean, this must be a common occurrence. And Dr. Hagemann, you must see it as well with your patients. What am I supposed to tell my kids?
Yeah, it's so common and often across the board incredibly agonizing to be sitting with your own salient, significant emotions, whatever they are for you, and then realizing I have to tell my children, right? And I guess you don't necessarily have to, but kids are so keen on how their parents are doing that they recognize something has shifted in time. And often parents grapple with how to have this conversation. And I think you did such a good job with you and your husband coming together, being on the same playing field, kind of similar language, and kind of deciding what to do, yet also doing it fairly soon.
Dr. Hagemann, what was the treatment plan? Because it was very intense. And when Faith and I spoke a couple of days ago, just kind of a pre-interview about what her chemo was like, it was every weekend in the hospital. Yeah. So what was the first plan of action? And then did that change at all based on what you originally thought you were going to be doing to help get rid of this cancer?
Yeah, well, first of all, with gestational trophoblastic disease, it is thankfully one of the most curable cancers that we know of. It's very, very responsive to chemotherapy. Specifically, methotrexate is the kind of gold standard for treating this. So it's a combination of something called emicotherapy it's just 5 letters for 5 different chemos. So she was getting right off the bat 5 different agents all together. We also then were able to shrink this tumor to the point where she was able to have a surgery.
Yeah.
This was the tumor on the lung, correct?
Yeah.
Did you have to have like a lobectomy, or was it just resected?
Yes, it's the whole of the 2/3 of the right lung. Yeah.
The
from
bottom
the
2
lung.
lobes?
Yes. They had to go.
Her numbers responded really well, but then they started to trickle up, and you started to have headaches.
Yeah.
And that meant we knew that something was going on in the
The
brain.
brain, yeah.
So you met with our radiation oncology colleagues and
On the team, yeah.
When you were doing those 5 chemo treatments, this is before the lung surgery and before the radiation, every week you went in. How did you manage that with your children and your husband working? How did that work?
So the first few weeks, we thought we got this. My husband would multitask, here and there. And it was tough, but we needed support. We really needed support from friends, because at first we denied support. We said, no, we can do our own laundry. We can do laundry for the kids. We can shop our own food. And we will need you. When we need you, we'll let you know. And then it hit us that, my husband is overworking himself. And that was a bit dangerous too, because he couldn't keep up with all that stuff. And he doesn't say it, but you can see it. And that's when we involve friends. So routines, we really wanted to maintain the routines for kids. So the bedtime, story time, meals.
Yeah.
So we had to find friends who can be able to do that. That was really hard for the kids, especially having mom after chemo at home all that time, especially weekends. Because those days after treatment, I didn't want any noise
or
anything.
Yeah.
Kids are here running up and down on the sofa, and I'm like, hey, can you just keep quiet for a second? And I decided that wasn't really good for them either. And I tried to see how I can be able to bond with them at that particular time. Like stories, bedtime stories. Even if I was sick, I could just sit with them over there and have a story or watch a story. And then they will sleep there with me. I'm like, okay, my husband, can you come pick them up and take them to bed? So that bonding emotionally, really helped a lot. But we have also had friends who could take them out, especially on weekends, for hikes outdoors. So that really helped a lot, hiking, because they take all the energy out there.
Yes.
And the thing that is so important that you were just talking about a minute ago, Faith, is that the connection and bonding piece, it doesn't have to be extravagant. It can be these small, nuanced, reading a story, making sure, if the routine is fragile that you had in the past, making sure there are routine components throughout the children's day, even if that has shifted. Yeah. Kind of predictability. So-and-so is going to take you glamping, right? Yeah. Like what to expect ahead of time, or dad's going to pick you up today from school. Like making sure there's some predictability inside the chaos of what it is to have cancer as a parent.
Yeah, there were times they could come to the hospital and we have dinner over there. Like they would come with their own dinner and say goodnight to me over there, and then they go home. And I think those bonding and also the conversations we had, because sometimes I could be there in bed and then I ask them, okay, can you tell me who got in trouble today? Ooh, and then they will talk and talk.
In the context of those conversations, you can also check in about how they're doing,
yes,
like their barometer about cancer. Because what we know is that the conversation, especially with children, just doesn't happen once. It continues.
Yes.
Right? There's these little conversations. So there might be a question about, will your hair grow back? Or just these little nuanced things that come up for them. And so having that space to be able to have conversations that are just neutral and check-in points along the way is so important. And it gives you a chance also to, if you felt like something didn't go well, to kind of try it again.
Yeah, absolutely.
Is it okay to tell your kids at times if they have questions, I don't know?
Absolutely. I think one of the things that happens often is we don't know with cancer. There's so much uncertainty, whether it's you can get treatment that day or, I know that your prognosis is good, but like there's a lot of what ifs, right? That we don't know for some patients. And that's an honest answer, but there's ways to navigate it, you know?
Yeah, like we're not sure right now, and I'm sure you have to navigate saying that to your patients. We're not sure how this is going to.
Yeah, and I think in our initial, we've got this, there were a few, wait a minute, what if we don't, you know,
Right.
because there's been a lot of ups and downs, and you're still in treatment today, right? We haven't necessarily reached that point where we're saying you don't need it. Thankfully, we have some great maintenance and enter immunotherapy, which we're really, really, really thankful for, has entered the scene for gestational trophoblastic disease. But, you know, I think what's so remarkable that you've been able to have these like little moments with your kids that are so meaningful in the face of these big life or death and treatment decisions that are being made. But at the end of it, like their life still keeps going too, right? They're still being kids. They're still playing on the playground. They're still having these friend moments that they want to share with you, and you get to share with them. And sometimes that's all that matters, right?
Well,
That's so important.
And that's really hard, I think, for parents to be able to understand it's okay to be vulnerable with your emotion. Like, it's okay to say, you know, I'm feeling disappointed or I'm feeling sad too, and we'll navigate through this together, right? These are the things I do when I feel upset, because you're constantly helping your children learn how to cope. Because they're watching. They're always watching.
Always. Right.
Sometimes when you don't want them to. But this idea that vulnerability is almost forced in cancer.
Your daughters were 4 and 7 when you started this. They're now almost 10 and almost 7, as they told me this morning. How...
Always rounding up, right?
Yes. Yeah, I'm almost 10. How have they changed with you through treatment?
This has helped them even to have, or to be more compassionate, to have more empathy, and also to rely on each other, because there are things like I thought they could not do.
Right.
I was like, me, everything, like me doing this for them, me doing this for them. And probably I couldn't have seen if I kept on shielding and probably doing everything for them. I think this was just a pause. It's an opportunity because it has created so many avenues on which I can now focus on in future. It was a pause to reflect, you know, and no, because sometimes we run so fast because we have dreams, we have visions, we have expectations, and then you forget some of these stuff. I think it was a pause. And I think also our love, me and my husband, has grown more because he has more time for me.
Oh, yeah. I have a question for you, Dr. Hagemann. How difficult or how often do you see your patients, because they can't control anything about the cancer, trying to control so many other areas of their lives, or trying to still be that everything they were, and them battling, like letting go and letting what's happening, surrendering to what has to happen at that time? And is that common, or is that just me?
I think that is so common. I think it's common for everyone when faced with a hardship of or a change or the uncertainty. You grasp at whatever you can control, right? And so, you know, for example, like you mentioned, do I get treatment this day? Like sometimes your counts were not right for treatment, and that is so frustrating because you've planned your whole, all the extra people that are helping, they were going to help today, not tomorrow. Or, you know, now we have to give you more Neupogen because the other thing, the side effect of all these chemos is your white counts are so low, you're at risk for infection. We want you to come in on Saturday for another shot in your arm. And it's just so hard, right? So like having to do that and have to spring on you, I feel like that is another time when you can just get just so angry or mad or like, why is this happening? And I think I don't know how to predict all the things that are going to happen, or to say, okay, we're just going to have to know that there's going to be uncertainties along the way. We might have to change doses. We might have to change treatments. We're going to reach out to, you know, you have a really, you know, you've been faced with like almost all the uncertainties we could think of. And so that happens to so many people when they're undergoing cancer treatment. So just knowing that you can't control everything. And just, I often just stop and say, are we breathing? Can we just take a moment, right? It doesn't take too long to take a couple deep breaths and remember, okay, we're actually here today, right? We did yet again wake up, and how lucky is that? And you're able to do that. And sometimes you remind me that you're doing that. Sometimes, hopefully, I've been able to remind you that we're doing that, right? And so we both feel that control. Actually, I mean, just to say, like, for the doctors, we want it to be in control too, and so we get really frustrated too. And sometimes it doesn't go the way we wanted it to.
There's a level of surrender that is kind of forced upon you when you are in these situations. There's only so much you can do, and you have to just eventually you have to kind of accept the reality. You're still going to have moments that are frustrating and stuff, but then you just realize, like, well, what can I control about this?
Exactly.
But you mentioned earlier there are opportunities that cancer presents. If it's a kind of strange statement, but opportunities that cancer presents. And I think, if you've been with the team as long as you have been, like with Dr. Hagemann, the barriers start to get kind of knocked down a little bit. And it's very easy to sit back and be like, I'm a patient. This is scheduled. We need to be doing what's scheduled. Like I'm a very foot on the gas advocate. But, after a while you're like, okay, well, I know Dr. Hagemann. I know her team. Everyone is literally doing the best that they can. I'm doing the best that they can, or that I can. We can't control this. We can't change this. The counts are off. Yeah. What am I going to do? Get mad at her team? Yeah. Get mad at her? I mean, like,
and it's okay. You can be mad.
Well, I mean, you can. But it's like, what?
Emotions are valid.
Yeah, no, emotions are valid. It's just, what I'm getting at is, it is an opportunity to remind yourself that, like, we're all only human. Like I would expect the best from everybody when I was going through stuff. And if there's anything less than that, I was like, my first reaction was to be, just a little more like demanding, or I just would advocate really hard. And then after a while I realized, like, these people got up early for this. They got, everyone's doing their best is what I mean. Everyone's human. And it's, I kind of learned that when I was going through it.
Yeah. And also sometimes, and it sounds like you're very fortunate with your support system and all of that, but sometimes the barriers do feel insurmountable, like logistically, practically, especially as a parent. And not all parents are partnered.
Right.
Right.
I was gonna say, there's plenty of single parents going through
there's
this.
so much pressure, and it can turn the volume up on anxiety and depression and all of these things that make it difficult. So, we also say, like, there's support out there, whether it's social work, whether it's our psychology service, different things that we can do to try to turn the volume down a little bit on some of those barriers, because that pressure can feel so heavy.
Right. We're going to be bringing your husband, Javon, in here in a second, because I'd really love to hear his take on what it's been like as a caregiver and as a father to your kiddos. But Dr. Hagemann, before we let you go, I wanted to ask you something about Faith's particular cancer. When you said that this cancer has a higher rate of being cured, even though they found masses and mets in Faith's lung and brain. So what makes this particular cancer, because a lot of times I'm sure you heard stage 4 and you were like, oh my gosh. Yeah. I mean, I just can't imagine what your initial thought was when you heard that. And then you start reading and doing research, and your husband was researching. But what is about this type of cancer or other gynecological cancers that are giving you hope in treating your patients?
Well, as rare as this seems, we have known for years that this particular cancer type is very chemosensitive. So we're lucky that we've had the tools, methotrexate being sort of an earlier drug in our chemotherapy armamentarium. It worked really well for this cancer. And so we've always had it, even for, something like persistent gestational trophoblastic disease, which hasn't gone on to metastasize. Single agent methotrexate alone can be very curative. And then we have, I guess I have hope because of all of the research that continues to be done. We have gestational trophoblastic centers in Boston and Chicago. We have colleagues, some of who trained here at WashU, who are national experts in gestational trophoblastic disease who know Faith by name, right? Because we've shared her story at multiple national conferences. So what I've also seen in this is how, her story is actually helping us shape our knowledge of this disease, which has presented a very unique way for you. If it's been, unfortunately, very persistent, it's kind of been sneaky. We caught it in your bone somewhere. We had to radiate that. We've done this, that, and the other thing to you as we've tried to treat this. But yet we have hope because of kind of the timing too. Like I mentioned, immunotherapy coming up as we've profiled her tumor with somatic testing, and we know that she has a very high tumor mutational burden. So just being able to understand more details of the cancer helps us give the directed therapies, right? We're really excited about all cancer types these days in terms of being able to find targets. And so I think that there's a lot of hope for maintenance and long-term good outcomes. But of course, we also know in the back of our minds that there's always going to be this uncertainty. We're always we're going to follow these betas forever. And so I don't know. I think I always have hope, and I want to make sure that hope isn't misconstrued in endless optimism, because the reality is we don't get to cure every cancer, and that is so sad. And so frustrating and so motivating to me to keep studying it. But in this one, I still, we got this.
I've noticed as we've been talking, Faith, throughout this time, there'll be times when you'll make a joke and you'll laugh and you'll get, your heart will light up talking about your husband, but then something will bring up and you'll sit there and you'll remember a time or how that felt. And seeing your reaction change just throughout our conversation, I think is so representative of what your daily life is like. The ups and downs of the fear, the joy, the thankfulness, the gratitude, the anger, all of it is so normal. And I've had times during this conversation where I've wanted to cry just watching you, because I can't imagine. And I just
cry.
But it's just really
try to stay strong.
That's my fault. I broke. But I just want to say that I'm really impressed with how open and vulnerable you've been. And I can tell that there's a true and sincere bond between the two of you.
Thank you. You, when you risk losing everything you've worked for, traveling miles away from home, and then just to come and leave my husband with young kids, it hurts. It really hurts. And that's why I said at the beginning, I had to make peace with myself and sit with this cancer thing and tell it, hey, look, I don't know what you think, but you can see my kids, you can see my husband. We've worked hard. We have dreams, not only our dreams, but our kids' dreams, and we're not going to go down without a fight. And having her to take me through this journey, I'm grateful. That's all I can say. I'm not yet there, but I have hope. And what gives me hope is for her dedicating everything for me. Everything I'm doing with all my strength is for my kids. They give me so much joy and hope, and I'm ready. Like whatever it takes, I have to fight and get out of this.
So Jovan, you are joining us now. You are Faith's husband.
Yes, I am. Thank you for welcoming me.
Mm-hmm.
And how many years have you all been married?
Since 2010, that's 15 years.
15
That's
years.
a long time.
Mm-hmm.
Yeah,
Yes.
that's a long time.
We were talking with Faith before, and she was talking about what an incredible support system you have been to her and to the girls. How have you, she said you were never stressed, which I can't imagine is actually the case. So I'm curious how you've handled mentally all the extra worries, concerns, and roles that you've taken on since this diagnosis.
First of all, I would say the strength I derive it from God. I'm born again Christian, and so sometimes things can be really stressful, or they can be very difficult to comprehend. And so I just composed myself. I think since she came to the U.S., she has been a good wife. And, we have 2 girls.
And also before she came to the U.S., to be clear.
Yes.
Not
okay.
just since she came.
Yeah, it's not like you came to the U.S. and you turned it
Yeah. So
for the last 10 years.
Since 2015, she's really stepped up. First 5 years, I wasn't sure.
Yes, thanks for the correction. Yeah, so I think I just got peace within myself, because this started when we were in Kenya. I don't know if she said that. She was coughing blood and so forth, and when we went to the ER, and everything was a kind of a roller coaster. And so I looked at my family. It's a very young family, and even though we have friends, there's no immediate family member here. And so everything comes down to like the head of the family. Okay, you have to worry about finances, you have to worry about their health, you have to worry about your job. I am a scientist. And so all this, when you put it together, it can be really overwhelming. Then you're like, okay, if I am the tree, if this tree falls, then everything is scattered. But I just got this peace within myself that everything is going to be okay.
Have you guys ever found yourself, and Dr. Tippey, I'd love some advice if there's other parents that go through this, getting down into the depths of the what ifs and letting yourself spiral into the fear? And if so, how have you worked yourself out of it? And Dr. Tippey, what advice do you have for parents if they're facing the same thing?
Yeah, so the fears were a lot. I think that was the moment where your life comes back like as a flash. And you're like, okay, since I came to the US, or even before we got married, and you can see yourself like in a movie, and then now I'm here, okay, this is the C thing, what is going to happen in the future? And you're like, okay, I have 2 kids. Do I have insurance? Do I have enough finances? Do I have, but then at the same time, you're like, okay, we're going to do this. We're going to go through this. And so the lows and highs, we sat down as a family, and then we started talking about. First of all, we talked, me and her, because we didn't really know how to go about it as far as kids are concerned. So they were not with us at that time when we were getting the news, because they were in school. But then we said, okay, let's take our time first to digest the news, because we were like, okay, if we don't know what to tell them and how they're going to react, then we don't know how to handle it after that. We didn't want to go like a spiral down the road.
It can be so easy to get trapped in it, though, right? And how
Easier said than done, right? From talking with so many patients and just looking at the research and the data, and I always mess this up, analogy or metaphor. I'll never, ever get it right. But this idea, it's like whenever you're diagnosed with cancer, you get a file in your file cabinet. And it's always there, right? And sometimes that file cabinet is really like straightened up and the drawer is closed. And other times, like the file's just kind of fallen out, right? And I think in those times when it's fallen out and there's a spiral, we have to help patients feel that, right? It's so important to feel the fear and feel the sadness and be with your emotion. And that's really hard to do, right? And then once you've kind of settled into that, because like we've seen today, like emotions are a roller coaster. Like you can get stuck in them sometimes, and there's strategies we can help with that. But kind of riding that wave, and then kind of you mentioned the now, right? Helping patients try to like not think about the past, not jump into the future, and be with what is right now. And sometimes that's really hard, and sometimes it's huge wins, right? And I think, with that spiral, being able to take a step back and know what is helpful to you, because what's helpful to you may be different than what's helpful to you. So it may be, you seek psychological services. It may be you go on a hike. It could be anything.
Go to church, say a prayer,
right?
Talk with other people.
It can be anything. Right. And I think really, I would be willing to bet that almost anybody diagnosed with cancer and their loved ones have had a spiral. you know.
Anyone with a biopsy.
Right.
Right?
Yes.
You know?
Yes.
And so you guys in particular sound like you have a solid foundation of communication and kind of ways to navigate stress.
Yeah, but also just to add on that, I know it is his time, but we've had our downfalls too as well. There were times I was worried about his health more than mine. There was a day he woke up, I was in bed, and he had to rush to ER with the nosebleed, like severe nosebleed. And he had to get admitted because that nosebleed, his blood pressure was way. So yeah, we had to have a deep conversation at that particular time.
Yeah, so that's, I think, is also part of managing stress. But also there's this thing in some people, maybe like me, you're like, okay, you're the jack of all trades, I can manage everything. But then sometimes you're like, you've exhausted all your energy savings and you have no room anymore. And I think that's what happened that day. And then the body just crashes. But, you know, in all this, you end up learning that, you know, we do have limits. And I think it's always good to let yourself be vulnerable and let everything sink. Because at the end of the day, you still have to live and you still have to support your people.
Yeah. We spoke about that with your wife earlier, that, you know, she's doing what she's doing to make sure she can stick around as long as possible and be there to help the kids and you. And you're doing everything you can for them right now, but you also need to make sure that you're taking care of yourself so that you can still do that.
Oh, yes.
So, I mean, it sounds like everything worked out, but I mean, was that like a one-off? Did they say like, hey, by the way, you have high blood pressure? Or were you just so stressed at that one moment, it just got that bad and then you leveled out?
Actually, I think I ended up realizing, yes, I do have a blood pressure. So I was on medication for some time to kind of, you know, control it. Now it's everything under control.
Just exacerbated that much by being exhausted and stressed.
Yeah, I remember one time when I was talking to one of our friends who are very supportive, and she was like, oh, you know, you have 4 jobs. And I was like, what? Oh yeah, you're a husband, you work, you have your full-time job at work, you're a caregiver, and also you are providing for everything. I'm like, oh yeah, you're right.
Yes, that's right.
It sneaks up on you.
Yeah.
Like you get, often people get so focused on like the checklist.
Oh yes.
Right? That they don't kind of focus inward on how
to manage yourself.
They're navigating that experience.
Yeah.
I'd love to just find out from each of you one piece of advice that really sticks with you that you received or that you'd want to give to another parent going through this, either as a patient or a caregiver or grandparent or, you know.
Yeah, I think take care of yourself. Sometimes you forget that you forget yourself as you give the care. And you'll give the best care if you're at your best. And in as much as you're putting the interest of the patients first, you should also put your own interest in the picture. And so that way everything will synchronize together to the well-being of everybody.
You know, as a patient, sometimes you get grumpy, but just be patient. Be patient with yourself, with the process. Sometimes it's not that easy, but just celebrate the small wins. Another thing is to accept support as much as you can. Your network is your net worth. Maybe I can say.
Your network is your net worth.
Yeah. Yep. The more friends. I'm not saying you should have a bunch of many friends, but your friends will really take you through. So the kinds you have to see what kind of friends you have, which friends you want to bring on board. The ones which will help you navigate through it, or the ones which probably will give you more stress and probably, you know. And also at the same time is you have to know, like right now, I said I have different kind of set of friends, or we do, and I'm happy about it because I have friends when my kids need help, they're those I can count. And when my kids they need like sleepovers or they need play dates, I have those which I can
They
count.
all serve different purposes.
And then I have friends for me, just for making me laugh, joke, not cracking up, like just being me. And I love it, and I keep all of them. So, and I think you just have to choose you and try to work through it a day at a time. Yeah, and for the kids, for those who have kids, make sure you engage them as much as you can. Play dates, swimming, classes, or let them get out there.
I mean, keep them engaged in life outside.
Plum camping, wherever, whichever that comes, as long as they're okay, it helps them also to overcome that kind of stress. And yeah, you have a happy family, happy life. Yeah.
Those are good pieces of advice. Dr. Tippey, what do you feel yourself saying to a lot of your patients when it comes to parenting and battling cancer? What could you say is one of the things that helps a lot of people, that resonates with them?
I think just a little takeaway is drop the perfection and turn up the connection, right?
Oh, I like that.
Two really good buzzy
Drop their
slogans.
perfection and turn up the connection.
Because kids don't need perfect parents.
Yeah.
They need to feel connected.
Exactly.
And you can do that in a multitude of ways, whether I think you said glamping, right? Or like a nap with mom.
Yeah.
Right? Like
Don't read a book, just fall asleep to a movie.
Or
It'll
just,
work.
like 10 seconds of eye contact and laughter, right?
Yes.
It doesn't
Right.
have to be big and bold.
Yes, exactly.
And you might want them to sleep in their own beds at age 7, but I can guarantee you they're not going to want to sleep with you when they're 17. They're not. So it's like, even if you start bad habits, I go through this all the time. I've had plenty of friends that have gone through stuff like, yes, there's a new normal for a time, but that doesn't mean it's going to be that way forever, right? Like, I promise you, if they sleep with you, they won't when they're 17.
No,
they're not
they
even
won't.
going to want to talk to you. Half the time. I'm kidding. Maybe those were just mine. But because we need to meet these great kiddos of yours. They've been very patient. They've been sitting around and waiting. So I would love to just meet them both and hear, just get a couple little tidbits from them of what they've learned through this process.
Okay.
Yeah.
Sure.
If we can do that.
Yeah.
Yep.
Then.
And Dr. Tippey, thank you so much for all of your input and suggestions and validating that everybody's cancer journey is different. And there's more than one
Absolutely.
correct, right?
Thank you.
Yeah, that is very true.
So joining us, we've been talking about you guys a lot. I don't know if you've been hearing how your parents have been talking about how proud they are of you, of being good siblings to each other. Susanna, you're going into 4th grade, and Sheena, you're going into 1st grade.
We found out that you guys are really good helpers for your mom. How do you guys help mom?
Well, we whenever she asks for water, we always go go in the play area and find a pack of water, and then just grab a bottle and open it for her and give it to her.
Yeah, she said she'd come home sometimes from the hospital and you guys would have everything laid out for her.
Yeah.
It's really sweet. Do you guys help Dad too when Dad's trying to help Mom?
Yeah.
How do you guys help Dad out?
So when he's like, can you just get this so that I can give Mom, we just do it because like when we don't do it, it's going to be for a hard time for Daddy to do it in such a time. Because also you have to do it like an example where he's in a rush to work, he's late.
Yeah.
And then he's just like, can you get this? And you don't get it, then he's going to be late. And
You guys are doing a lot of big kid stuff, right?
Have you felt ever at times like you were worried or really sad about your mom or your dad? And if so, like, how did you guys kind of work through that? How did you get through it when you felt really sad or scared?
Normally pray and just tell yourself, we'll go through it, and everything's going to be okay. And just know that God's going to help us.
We prayed, and we also since we prayed every day, and we went to the doctor, and every day, and we pray every day, so it can help her go through cancer. And then we're like, okay, we're gonna make it.
What's like the most fun thing that you guys have done that you didn't think you were going to do because Mom was sick and you just thought, oh, we'll go try this? Like camping? Have you guys have gone camping, is that right?
And we get to sleep in the cabin, and we also had we went kayaking, and we get to play in the muck.
It seems like both of you know that, being sick is hard, and taking care of somebody when they're not feeling good is really hard. But I think it sounds like your parents have done a really good job.
Mm-hmm.
How do you guys think they've been doing getting through all of this?
Actually, really good.
Yeah.
Whenever we figured out that mom has cancer, we weren't just all like crying all over the place, just knowing we're not gonna make it. Instead we're just like, hey, we all know that mom has cancer. It's just that when we pray more and more, God's gonna help us get through it.
At first, I was worried. I'm like, is she gonna make it, or is she just gonna pass out? But my biggest worry is if she was not going to make it, and then we just prayed, and then one time she was screaming up and down, I only have 2 cancer cells to go, and then we're like, okay, we're gonna make it.
Yeah. You saw some victories happening, right? You're seeing her have some wins, which is making you feel better.
Yeah.
Right? What advice do you think you could give to other kids if they're feeling sad or they're feeling scared because maybe their parent is sick with something? What could you tell them to help maybe make them feel a little bit better?
I would honestly tell them to pray and also say it's going to be all right. You don't have to cry, and just help them feel better. And that's what I would do.
That's good advice.
Mm-hmm. Yeah. I would tell them to be brave. Just know that it's going to be okay. And, just know that you'll go through it. And if you feel like you're stuck inside your feelings, just go to your bedroom, close the door, and just scream in a pillow or something.
Seriously, that works.
Yeah.
It sometimes helps. Either deep breaths, like we said before, or screaming as loud as you can into your pillow. You got to release that stress sometimes, right?
Really.
Thanks for coming on the show, too. It's going to help a lot of other kids that might, maybe one of their parents might get sick and go through what you guys did, too. So you guys, just kind of like how your parents set good example for you guys set a really good example for other kids. So thanks for coming on and showing how to be brave and be good helpers to your parents.
Mm-hmm. You're welcome.
And I just want to mention one more thing that I noticed. What I think is pretty cool is that you were saying things and you saw your mom crying over there. Like you see, moms cry all the time. I mean, I do it all the time. And you're just like, yeah. And we're talking about a hard subject, but you're letting her have her emotions. You were totally locked in, right? Mm-hmm. And I also think that when kids go through, you're going to be really good empathetic listeners for other friends as you get older. Yeah. When they struggle with things, you'll be really empathetic, and I bet you'll be really good listeners because you'll remember what you've kind of gone through at times, right?
Yeah.
Faith, I know there's something you'd like to say to your kiddos before we wrap up.
Yeah. Yes, so I want to say, Susanna and Sheena, I am so grateful that you're strong, and I was worried before when I got the news about cancer. I was not sure how you guys gonna be, but see how I'm so proud of you. You're strong. Just know that those little things you keep on doing, like to me, making sure that I'm feeling better, I appreciate so much. And thank you for always being there and praying for me in the bedside at the hospital and at home too. Sitting, watching stories, those are my best memories so far I can have. Just having time with you guys all the time. And to my husband, thank you so much for being there for me.
You're welcome.
I can never doubt your love for us, and being there for us. Thank you so much.
That's good. You're welcome.
Thank you.
You're welcome.
And for you guys, thank you for having us here.
Thank you.
Thanks for coming.
Thank you.
Yeah,
so
you
much.
guys have been, for me personally, just a blessing to be around today to show what family and love is. It's just that simple.
Good to hear.
It's what you need, right? It's all you need.
True.
Yeah, and snacks.
Don't forget.
Let's be honest. Let's be honest.
Yeah.
All right. So you were in the recording booth earlier watching, and now you've been on this end of the microphone getting a little bit of production experience. So you can close this out by saying that's a wrap.
That's a wrap.
All right.
Good.
That's the end of the episode. Cut. Thanks for listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis.
National leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu and be sure to leave us a review and like and subscribe wherever you listen to podcasts.